Did you know that you can get serious and sometimes fatal diseases if you neglect something as simple as brushing your teeth every day? Today, let me talk you through 5 serious diseases you can get if you have poor oral care habits. You could get endocarditis and cardiovascular diseases. Let me try to explain. Endocarditis literally means inflammation of the inner lining of the heart. The heart has three layers: the epicardium, or the outermost layer, then the myocardium, which is the middle layer, and then the endocardium, which is the layer that gets inflamed. Most cases of endocarditis is often caused by a microbial infection of the endocardium. How do microbes get into the bloodstream? Infection can occur if you have an open wound or abscess, especially in your mouth, have had oral or dental surgery, or if you use an infected needle when taking illegal substances. So imagine if you have sores or wounds on your gums from, let's say, gingivitis or periodontitis. Definitely run the risk of having microbes get into your bloodstream and into your heart, thus causing endocarditis. Number 2. Brushing your teeth is not just good for your oral health, but it can help protect your brain too. Because according to studies over the last few decades, there seems to be a connection between brushing your teeth and Alzheimer's disease. Alzheimer's disease is a neurodegenerative disease that causes gradual memory loss and cognitive decline. It is the most common form of dementia, which usually begins in late to middle old age. This connection centers around an oral infection called periodontitis, where soft tissue in the gums is destroyed and eats away at the bone that supports the teeth. Left to its own devices, it will give bacteria a breeding ground, wreck someone's pearly whites, and leave them with bleeding gums. As periodontitis breaks down cells in the gums, the bacteria P. gingivalis is able to break into the rest of the body. From there, bacteria can travel to more distant organs and establish bacterial colonies in places it's not meant to be, including, as animal studies have confirmed, the brain. In the brain, P. gingivalis releases toxins called gingipains, and that's where things get really messy. The thinking is that these toxins compromise the tissue structure around the bacterial colonies that makes the brain's protective barrier leaky, damages cells, and impacts cells' ability to function correctly. Number 3. Oral cancers are cancers that originate in the oral cavity. The oral cavity includes the lips, the gums, the floor of the mouth under the tongue, the buccal mucosa, which is the soft lining of the lips and cheeks, the front two-thirds of the tongue, the hard palate, and the retromolar trigon, which is the tissue after the last molar of the bottom teeth. Aside from the oral cavity, you also have the oropharynx, which consists of the soft palate, tonsils, walls of throat, and the back one-third of the tongue. Some types of oral cancers include adenocarcinomas, extranodal lymphomas, melanomas, and actinic cheilitis. And some symptoms of oral cancers include numbness or changes in sensation, hoarse voice, pain or difficulty chewing or swallowing, both painless and painful lumps, sores, and discolorations. You'll always be on the lookout for white lesions, a rough or irregular, velvety, or speckled surface anywhere in the mouth, as well as growths that grow inward or outward. Number 4. Pneumonia. Pneumonia is an infection in the lungs caused by microbes. This infection brings about inflammation and infection and brings water into the lungs. This extra water can make it harder to breathe. And sometimes, a particularly nasty microbe might succeed in colonizing the bronchioles or alveoli. These microbes typically invade the tissue, and the lungs will develop an inflammatory response by filling the lungs with white blood cells, proteins, fluid, and red blood cells, thereby damaging nearby capillaries in the process. Poor oral health can cause pneumonia, as certain bacteria in your mouth can be pulled into your lungs. Number 5. Erectile dysfunction. An erectile dysfunction occurs in individuals unable to develop or maintain an erection. This is also commonly referred to as impotence, and commonly occurs with age. Physical intimacy can be very important in relationships, so erectile dysfunction often carries with it emotional and psychological stigma. What connects poor oral health and erectile dysfunction? In a word, inflammation. Inflammation is the body's immune response in action, may spread from the gums and harm other parts of the body. Gum disease is marked by bleeding of the gums and bone structure of teeth, and if left untreated, can cause tooth decay and tooth loss as immune cells launch an all-out attack on the pathogens in the mouth. These bacteria can also seep into the bloodstream and damage blood vessels, and because erectile problems can be caused by impaired blood flow in the penis,
Poor dental hygiene can be associated with erectile dysfunction. So, just how can you protect yourself from serious diseases brought about by poor oral hygiene? We consulted with Dr. Carla Quizan of K Dental Studios on how one can maintain good oral health. Head on over to the York University SES Wellness and Lifestyle blog to read Dr. Quizan's top 5 tips on ensuring great oral care to result in an even better overall health. Thanks for joining us today.